But from your experience, what type of influence has an environment, a working or a living space in general on our mental health?
We are not doctors, right? But I guess, and also from my own experience, our children's experience, when you bring them to the doctor, right, it has often something to do with fears or worries, right? So when you go to a treatment, you know, okay, I need this treatment, but waiting for your appointment, waiting for the doctor, waiting for the results, this is all related to, for sure, worry, very often to fear, depending on the situation. So now coming in us as a designer, interior designer, now how can we create the best possible environment to lower this to a minimum, right? There's certainly the doctor has to have the right kind of speech to the patients. And as I said, I think a space needs to be somehow modest, right? Needs to be humble, needs to not create surprises. Maybe surprises you need in retail, right? But you don't need it in these kind of designing for health. You need to be ideally keep the energy in the room, right? Be centered, don't create maybe a low contrast, I would say. Talking about materials, we talked about colors, but in general, if you create a high contrast, it's more nervous, right? The colors or the different dark and bright tones fighting with each other. So if you make this all turned down and more mellow, then automatically you create more ease via the interior design. I think that's something how I would see it.